One of the focuses of this week's Doctor on Call was how, as a developing nation, can Grenadians better diagnose, manage, and treat existing conditions to decrease our mortality rate. Medical practitioner Dr. Francis Martin, the guest on the program, addressed step-by-step ways to reduce the mortality rate in Grenada.
I think we have to take a look at our Grenada culture. The things that rings well with the Grenadian people. The things that we value most. We must take a look at that. We also need to know what's happening in our societies. We need to be aware of what diseases are happening, who is getting what type of disease. And so community profiles are an excellent thing that must be done. In every community, we must be aware of who is getting sick and why they're getting sick.
Dr. Martin said creating profiles by identifying who is coming down with what illness is an important factor in determining how the country can move forward to improve the health of the populace, as it makes way for intervention by medical professionals.
The things that create the environment for disease and ill health to take place. So after we have done our epidemiological profile, we know who is dying from what. Then we now figure out what services we need to offer to prevent these people from dying. We've got that under control. Now, the third is to develop a delivery system so that we can get the care to the people where they are and to take care of them upstream. Well, fortunately for us, we do not have to reinvent the wheel. The delivery system for healthcare that has proven over the decades to be beneficial to developing countries like Grenada is primary healthcare.
Private healthcare, Dr. Martin says, is the most effective way to provide healthcare in developing countries like Grenada.
We're aware that the primary healthcare system is the best and most affordable way to provide healthcare in developing countries like Grenada. Grenada was very fortunate in the sense that during the revolution, the then government of Grenada saw the benefit of primary healthcare because I think at that time, Grenada was extremely close to the Cuban system. Even now, we're still very close to the Cuban system. And we benefited from some of the pillars of what the primary healthcare system in Cuba was like. And so we now have already known the data that that's how it has to happen. How we make it happen? What mechanism we're going to use to make it happen? What process we're going to take to make it happen? What road we're going to take to make it happen? That's where the rubber hits the road and the proof is in the proof of the pudding is in the eating.